Sean, this year has been tough.
Mm.
Whatever way you look at it, COVID-19, it's taking a toll on our physical health, our mental health. And staying at home is actually nice in some ways, but also creating real strain on relationships.
Yeah,
And if you are struggling with erectile dysfunction, it can put an additional strain on your intimate relationships. But we have someone here who can help.
absolutely. He's not a therapist, but he can help with that last thing. Is Andrew Reinhardt. He is with Boost Medical Clinic. He joins us now with more. How are you there, Andrew?
Hey, I'm doing great. And that's right. There has been, I think it's safe to say, a medical breakthrough when it comes to erectile dysfunction. The reason I say breakthrough is guys have taken the pill for ED for 30 years.
Mhm.
Boost Medical now uses the most advanced form of acoustic wave therapy, clinically shown to open up and regrow blood vessels. So, what we see is that we can eliminate erectile dysfunction. We get the blood flow going where you want it, when you want it, and you don't have to take the pill any longer.
We've talked about this before. This is a blood flow issue. It's not it's nothing more than a blood flow issue. So if you can find a way to get the blood flowing again, you're good to go. Now, well, obviously, we know the one obvious problem with ED. What are some other common problems that you'd expect?
Well, I'll tell you that ED is a massive issue, of course, and it can wreak havoc on a relationship. And what's interesting when we talk about ED is that there's so much erectile dysfunction out there that goes untreated. And, guys
Mm.
are a little bit embarrassed to talk about it. So
Yeah.
they do nothing. And what happens? The problem gets worse. Sometimes they go to the pills and the injections. They deal with the headaches, the blurred vision, the lack of spontaneity. And as far as I know, our treatments are the only thing that address the root cause of the problem and restore that spontaneity.
Hmm.
Which is a whole lot smarter than just relying on a pill. And you can see that there wouldn't be the same side effects. So, from a health perspective, this seems really smart, Andrew. Tell us, erectile dysfunction, it's not just an older guy's problem, is it?
It really is not. We have guys in their 20s and 30s every day in our clinic, and we have guys in their 80s and 90s. And I will say this, if you're out there listening and you're struggling with ED, or your man is struggling and there's some function left, maybe 80%, 70%, that's actually the easiest to fix. So you're not too young and you're not too old. This can happen to anybody. And the good part is that our treatments can work for the majority of people despite age or health history.
Interesting. Now, have there been any clinical studies done behind this? Are there side effects to the treatment or no?
Extensive clinical studies. You can go to the science page at boostmedicalclinic.com, read all about them. But Cambridge, most people have heard of Cambridge,
Yeah.
has tested this technology, very high success rate. The American Urological Association, they've tested it with, I think, 600 men. They said safe, effective, revolutionary. And on your question of side effects, there has never been a reported side effect. This is non invasive, kind of looks like an ultrasound machine, just placed on the skin, and it delivers those pressure waves into the blood vessels. It's very rare to be able to say no side effects in the medical world, but
Yeah,
that's what we're talking about here.
no question.
Andrew, since you deal face first with patients, I know that you understand the whole patient experience when it comes to your treatment. Share with me some of the biggest fears or reservations that men have when they walk in your door, and maybe you can address them too.
Well, no man likes going to the doctor, and the ED doctor much less. So that kind of goes back to a lot of erectile dysfunction goes untreated. I think that this is tied to a man's ego,
Yeah.
sense of self worth. I mean, we just be honest about it. So they think they're less of a man if they have erectile dysfunction. We strongly disagree. In fact, I think it's being less of a man if you don't treat it. You let the relationship suffer. This is so attached to our happiness. So think about this 2 to 3 weeks of treatments. That's the typical duration that our patients go through.
Mhm.
2 to 3 weeks from now, you could throw the pill away, get your relationship back on track, and put a stop to your ED. So overcome the embarrassment. It's so much worse to continue to suffer.
No question. Let's get it over with and get moving. I mean, why not? And there, by the way, no scalpel required
Exactly.
as well, which is great. No one wants a scalpel
Phew.
down there. Really quickly, a special offer for viewers right now that are watching this and saying, you know what, enough is enough. 2020, we're going to turn this thing around.
Yes, if you're struggling with erectile dysfunction or your man is struggling, call us now. We're going to do a lot for free. The initial assessment, exam, the blood flow ultrasound, even, which tests your blood vessels, is all free, plus a little special gift that you're going to love. It produces instant results in the bedroom. It's free to everybody that calls now.
Awesome. Great to have you, my friend. Thank you. Thanks
Andrew,
for
thank
joining us.
you.
Thank you.
All right, take advantage of that special offer. A free exam with a medical doctor, including a free ultrasound blood flow evaluation, plus a special gift that'll get you some instant results. You want to call 702-710-5000 or go to boostmedicalclinic.com. Boost Medical Clinic, a proud sponsor of the Morning Blend.